Hi, my name is Victoria Diaz, and we're going to do video number 5, and we're going to start with chapter 21, which is the assessment of the abdomen. To begin with this assessment, we're going to start with the inspection. We're going to inspect for the contour of the abdomen in general. We're going to have the person either stand up, in this case, most likely the best is just to have the person lay down. And from a sideways point, we're going to determine the profile of their rib cage, which is indicates the beginning of the abdomen, and we're going to look onto the beginning of the pubic bone. That indicates as the abdomen area. There are several, it should be normally, it should be outward, it shouldn't be extremely outward, or inverted, or it shouldn't be, with any weird shape. Abnormal findings could be, such as I mentioned, the escaphoid, which is totally inverted like this. Inside, you will look at the abdomen. Protuberant is like extremely outward, and distension is just, you can see the entire abdomen is just rounded, very, very big, and it's hard for palpation. We're going to look at the umbilicus. It should be midline, inward, no protrusion should be present, or any inflammation of redness, or any discharge or foul smell. If it's protruded, you may indicate the person has a mass or a hernia, or even ascites, which is the condition that indicates fluid on the peritoneal cavity. It tends to be a little bit protruding on pregnant women, but that just goes away after delivery. We're going to look at the skin. It should be smooth, even, no discoloration, any abscesses should be present. This is a good area of the body to assess for the normal pigmentation of the person because it's not usually exposed to the sun. We're going to, if we assess any, if we look at any lesions that are present, we're going to know the size, the area, if it's well approximated, in the case of like old scars, if it's well approximated or not, if there's any X-ray present, infection, inflammation, redness, odor to it. If we see any moles, we're going to assess for the size of it, if when application there's any change that is noted on it. For the hair distribution on the pubic area, for the women it's on a triangular shape, and for the male it's on an upside down triangular shape. Any abnormal findings that we can find in the abdomen could be angioma, cutaneous angioma nevi, which indicates the presence of portal hypertension, that it should be the impairment of the renal artery, of the hepatic artery. Petechia, which is the presence of little dots of colored red, all dispersed around. Jaundice, purpura, which indicates the presence of Cushing's, or it's either absent in the cardiac disease. It may indicate also hormonal issues. The demeanor indicates how the person is standing, how the person reacts as we are assessing. If the person is comfortable, relaxed, and even respiration means that there's nothing wrong with it. They're just sort of comfortable. There should be any guarding, like in one area, may indicate the person has any pain. If there's any constant moving, may indicate gastroenteritis or colics or bowel obstruction that it might be. We're going to look at the pulsation and movement from a sideways standpoint. Sometimes you're able to look at the pulsations of the aorta in people that are really skinny, or you might be able to see a peristaltic movement of the bowel. We're going to change the pattern of the order of the nursing assessment for the abdomen, and we're going to auscultate before we palpate. You can start assessing on the right upper quadrant, and then you move across, and then you move to the other side, and you move to the left side. You should be divided in 4 quadrants: right upper quadrant, left upper quadrant, left lower quadrant, and right lower quadrant. You should listen for at least 5 minutes to determine if the sounds are either, there's 3 types of sounds. It could be normal, which is, at an even pace, there's nothing really hyperactive, which is very high-paced movement of the bowels, or hypoactive, which is usually present after surgery, or when there's inflammatory process going on, a bowel obstruction as well. Ideally, it's very normal pace. The vascular sounds, we can check for the aorta. We can also auscultate to listen for the pulsations of it. We can also listen for the renal arteries, the iliac and femoral arteries. especially people who have hypertension. And the points are, you auscultate the aorta over here, the renal arteries, the iliac, and then the femoral over here. The palpation, we are going to assess for any tenderness upon touch, for any distension, any presence of pain, any, guarding of the area. As we are going to percuss is the next step, and we're going to assess for general tympany. On this area, because the bowels are constantly in movement, there's the presence of gas, and it should always be the presence of tympany. You determine this in the four quadrants, and you move, in a around the clock motion. So we percuss like this, and the only part that touches the skin should be this part of the finger, the very last phalanx, and then we percuss on the last one. If dullness occurs, it may indicate that the fluid is present, or any mass or any distension is going on, and we should further continue assessing. It is also important to determine the liver span, and by that way, we mean that the size of the liver of the person. For this, we're going to calculate it by identifying the right microauricular line, which is this one right here, and then we're going to go sideways alongside from towards the area of the midline of the axilla over here, the mid-axillary line, and from then on we're going to start percussing until we first we're going to identify the lung resonance, and we're going to move downward as we're percussing until we feel that the sound changes to dullness. That's the end of the liver. We're going to mark the beginning of the beginning when it stops the lung resonance, and also the end that you feel the dullness. The normal liver span goes from 6 to 12 centimeters, 10 centimeters for males, and 7 centimeters for females. Where you can go across in the SI and pause and assess for the splenic dullness. For this, we're going to percuss between the 9th and the 11th intercostal space, which is this is the fifth, and then we go 6, 7. So between 9 and 11, around this area should be it should be present the spleen in the anterior axillary line, which is this part over here. Most of the time it's obscure about the stomach contents, and it should not be palpable. The moment that the spleen becomes palpable, it may be due to the presence of disease such as mononucleosis, malaria, or hepatic cirrhosis. There are some special procedures that we can perform to assess specific things on the abdomen, such as the fluid weight that assesses for the fluid presence in the abdomen. We're going to ask the person to, we're going to stand on the right side of the person and have the patient place a hand on the midline of the stomach. We're going to go with our right hand, place it on the left side of the patient, and we're going to quickly make we're going to produce like a wave, and then if we feel it on this hand, there's a positive for fluid. That completes the assessment for chapter 21, the assessment of the abdomen.